And the World Health Organization has raised concerns over the rising numbers of COVID-19 cases in Kenya, which they attribute to laxity and lack of compliance in observing the containment measures by most Kenyans. Warning about the stage of the pandemic, the world global body called on the government to enforce containment measures to flatten the curve. This, even as 679 new cases were recorded in the last 24 hours, bringing the national caseload to 28,104. Now, 18 new deaths were recorded, including a KEMRI director. Let's get more from our very own Dorcas Wangira.
In mid-March, when Kenya recorded the first cases of COVID-19 and containment measures were instituted, majority of Kenyans strictly adhered to the rules. But since the lifting of the cessation measures, there is full-blown community spread, mainly owing to a sense of laxity and disregard for the health and safety measures. A trend the World Health Organization says is worrying.
In recent weeks, we have observed with concern the rising numbers of COVID cases and the scaling up of community transmission in Kenya. We've also seen a general laxity in individuals' behavior from the initial widespread compliance before the opening up of the lockdown locations.
The global health body says in order to contain the number of fatalities, now standing at 456, Kenyans must observe social distancing and hygiene measures.
These deaths are not just numbers. They are a mark of pain among families across the country.
679 new cases were recorded in the last 24 hours from 6,590 samples, bringing the total caseload to 28,104. 743 recoveries were recorded, bringing the total number of recoveries to 14,610. 18 deaths were recorded, 15 of whom had pre-existing conditions. In regard to the race for a vaccine, Kenya and South Africa remain two front-runner countries in Africa considering vaccine trials in collaboration with partners such as the Oxford University.
We have collaborations with DFID and different other partners in terms of ensuring that when this vaccine is found, that Kenya does have a stake in terms of being able to get the vaccine.
2 or 3 of the vaccines have moved on to the phase 3 trials, which make them part of a large number of testing so that we can determine the efficacy and safety of the vaccines.
Dorcas Wangira, Citizen TV, Nairobi.